And what has happened in the last 10 years is that I get a lot of patients, and a lot of my colleagues get patients who have these vague symptoms, like they're chronically fatigued, or they have insomnia, or they have belly bloat that's really debilitating. Some people have joint pains that they can't get rid of. And when they go to their doctor and they do all the testing, the test results, they come back normal. And so I wanted to show you how we, from a functional medicine perspective, look for optimal levels of all of your labs versus the normal levels. So in the last 10 years, I've become certified by many institutions out there. I started as a holistic health coach 10 years ago, went on to many, many functional medicine trainings, and I continue to do so. So what is functional medicine? It is basically a personalized, patient-centered approach where we try to look for what is the reason you're having whatever symptoms you're having. For example, even depression, it's not necessarily why you might need medication. It's not necessarily a Prozac deficiency or a Wellbutrin deficiency. And so there might be an amino acid that's off. You might be lacking nutrition. While there is a place for medication, there may not be. There may be another reason that you're feeling depressed or you're feeling tired. So a functional medicine approach really kind of takes a look at you as a whole. And we do test, we don't guess, but we don't just treat the numbers. We treat the patient as a whole. And in fact, I've stopped calling my patients. I call them clients, because they have enlisted me as a part of their team. You know, a doctor doesn't have all the answers always, and we have to realize that. So first of all, I wanted to explain to you how all the labs that you go to actually get their reference range, which is the normal range for the blood test. And what they do, for example, LabCorp or Quest, they take all of the patients in their database, which could be hundreds of thousands of patients, and they take 95%, whatever 95% of people fall in that range, they label that as your reference range, or what is considered normal. So over here, as you can see, that they look for 95. If you're within 95%, then that means that your labs are normal and they're not worried. Whereas if you're 2.5% of the people who are outside of that range, then the levels are considered high and flagged. And if you are only 2.5% to the left, then they're considered low. And in functional medicine, we think that that's too large of a reference range. And what we look for is optimal levels, which is right around here, because what we have noticed is that even if you're falling over here, you might not be feeling well, and those labs are not considered normal for us. So today, we're going to start with the CBC panel. And this is a panel that I'm sure all of you guys have gotten from your doctors when you go for an annual visit. And what this does is it measures the different components of your blood. And what we're going to look at right now is something called the WBC. Now, the WBC, what I want you to get next time you go to your doctor, which you may have, is ask them to get a CBC with a differential, because the CBC has 5 different markers in it. The WBC, I should say, the white blood cell count, which tells you often if you're fighting some sort of infection. And what we want to look at is all of these 5 different cell types, because they can give us a clue as to what might be going on in our body if we have some symptoms, like if we're feeling tired or we're not just feeling ourselves. So all of these make up the WBC, and they should all add up to 100%. So again, we want to make sure you get the differential when you get your CBC. And usually this is covered by insurance. So first of all, let's talk about the different cells. These are the different cell types. And first, we're going to talk about neutrophils. This is a reference range for functional medicine, but I do want to share with you. Let's see. Okay. I do want to share with you that this is based on thousands and thousands and thousands of testing that we have done, blood panels that myself, my colleagues, and my mentors have done throughout the last 2 decades, even before I started. And the numbers that we have come up with, where we actually get answers, are for the neutrophil number count, we want it to be at 60%. Even if it's at 61%, then it's a little too high. Your doctor is going to tell you it's normal, but I'll explain what that could mean. So if a neutrophil count, the percentage is even a little bit above or a little bit below, then we're going to consider having that you may have an underlying bacterial or fungal infection. Now, I'm not suggesting that you go running to your doctor and get, an antibiotic or treat any of this. This is low grade, because if it was very high, you would already have, known about it and you would be getting treated. So if it's a little bit higher, a little bit lower than 60, we're going to consider you have an underlying chronic kind of bacterial fungal infection, which if you improve your immune system, you should be able to fight it off naturally. Again, I'm not suggesting taking medications for this. This is just what we have seen from a functional medicine perspective. So the next is lymphocytes, and the magic number here is 30%. And just remember this should be a 2-to-1 ratio here. And if the lymphocytes are a little bit too high or a little bit too low, we are going to be considering an underlying virus. Now, all of us have been exposed to viruses, whether it's Epstein-Barr virus, cytomegalovirus, but usually our immune system is so good that, we live in harmony with the bacteria, the viruses, and everything else. But an example of this would be if you or anybody gets cold sores. Have you ever noticed that when you're under a stressful situation, then the cold sore appears, which is a virus, right? So it's a herpes virus. So this is what I'm suggesting, is that we can kind of help with all of these numbers and how you're feeling through diet, dietary and lifestyle approaches and stress reduction. So the next one is monocytes, and the magic number here is 7. If monocytes are elevated, again, we are thinking virus. And Epstein-Barr, a lot of us have Epstein-Barr, which kind of surfaces when we're under a lot of stress. Even if you test for Epstein-Barr, it may not show up unless the monocytes are above 12%. So even if it's negative in the blood, doesn't mean that you don't actually have that virus at the moment that you test. So next up is eosinophils, and these can represent 2 things. The number we're looking for is 3%. And if it is elevated, we would consider that you might be exposed to parasites, which all of us really are. You can get parasites from traveling abroad. You can get it from the vegetables, if it's not washed properly. So we can pick up a parasite at any given point. And usually it's not harmful, but sometimes if you have some chronic conditions, even if it's eczema or arthritis or brain fog, fatigue, it could be a parasite, in which case we do a supplement protocol to treat the parasites. Again, we're looking at all these numbers. So next up is your basophils, which the magic number is 1. And this also indicates parasites. You might be wondering, this actually adds up to 101%. That's because usually it's 59.1 or 61.2. There's always a decimal point, but in general, this makes up the entire WBC. So there is something I also want you to look at on your blood work, in case you have it with you, is that we like to see the neutrophil to lymphocyte count, or the ratio, as 2-to-1. And when we start to see it narrows, like this might be 40 and this might be 35, then we should be considering a possible underlying autoimmune condition, which could be something from ulcerative colitis to arthritis to celiac, or even just inflammation in your body from eating the wrong types of foods. So this ratio, we want 2-to-1. And if it is not, then we're going to consider possibly an autoimmune issue. So here's the other caveat, is that I haven't done blood work on LabCorp or Quest in years. We have our own lab that we work with. And so they usually apparently do not give percentages. So I wanted to give you a formula that you could use to get the percentages. They usually give you absolute counts. And so this is the formula which you can use to convert those absolute counts into percentages. And what you would do is, for each of those 5 markers or those cell types, you would divide that by the WBC and multiply it by 0.1 to get the percentage. So in this case, if your absolute count is 4157, this is a patient of mine, or a client of mine, and her WBC is 8.5, you just divide the absolute neutrophils from the WBC, multiply it by 0.1, and there you go. You have your percentage. Remember, we want this percentage at 60%. And you would do that for the lymphocytes divided by WBC, and get that percentage. So remember, the percentages we're looking for are these. So in that client record, I just wanted to show you, so the ratio is not 2 to 1. And so in her case, she did have an underlying autoimmune condition that was going on and causing a lot of inflammation in her body. And that's usually the type of client that comes through the doors here at our clinic. So now that was a WBC, which focuses on infection. And a lot of us do have underlying chronic, low-grade infections that are not dangerous, but that can cause some symptoms that cause us to feel dis-ease. Not disease, but dis-ease. And so that was a WBC. And now we are going to focus on, very briefly, the red blood cells, which is the RBCs, your hemoglobin, hematocrit, and all of these numbers on your CBC. Most of you guys should have these. These are all standard. So what I want to focus on is that if any of these numbers are on the higher side from a functional medicine perspective, it indicates that you need B vitamins, or a good source of B vitamins. And generally speaking, you would need methylated types of vitamins. That's a whole other topic. So if these are slightly high, then you would need to increase your B vitamins through supplements, or even just through foods. And if they are low, slightly low even, that means that you probably have an iron deficiency. The problem is that we are talking an optimal number. So even if they're high or low, and you take this to your doctor, they're going to say your CBC is normal, your WBC is normal, so you don't have to get tested for your iron. But if it's low, even in one of these, I would suggest that you ask your doctor for an iron panel, which includes tests like transferrin and ferritin and a couple of different things to see what actually is going on. And you need iron because iron is on the hemoglobin. That's what brings oxygen to all of your cells to give you energy, to help you feeling good and living a long, healthy life. So high or low numbers, you can have one or you can have both. Here's another way of saying it. If it's above those numbers, usually you need some B vitamins. Below, iron deficiency. And it could just be minimal. If it was a serious iron deficiency anemia, you would already know about it, because you would possibly be taking iron supplements or even iron infusions. So generally in our clinic, again, the people that we see are usually people who just have this low-grade fatigue and different vague symptoms. And we usually just treat all of it with supplement protocols. And we see some amazing results. I mean, miraculous results, because once you kind of get rid of the excess bacteria or the virus or the parasites, a lot of times the body comes back into balance. But we always start also with diet and nutrition. So this is a short workshop. I just wanted to empower you so that you could learn a little bit just about your CBC. But now I wanted to tell you the different next steps that you could take, especially if any of those applied to you. So, of course, change in diet, lifestyle, sleep, vitamins, and supplements. We're going to go into each one in detail. Let me take a look to see. Okay, I can't see. So, foods. I've done so many webinars on this. We all know that we need to eat healthier. Even for those of you who are eating healthy, we know we can do better. And this doesn't stand for everyone, but in my case, unfortunately, I know that when I eat a pasta or I eat a sandwich, that I'm feeling brain fog, I'm feeling tired, I don't feel good. And we should understand that food is meant to nourish our bodies and nourish our cells so that we have energy to keep moving forward. Like, let me ask you guys, and I can't see you guys here, but who here has ever had an apple or a banana and just felt like they had to crash and go to sleep right after? I'm guessing most of you have not felt that way. Or who here has had a salad as long as you can digest it, and you feel tired afterwards? Whereas many of us, when we have these types of foods, we feel tired. So that's one way your body's telling you that, okay, this is causing inflammation in my body. Same thing for dairy and cheese, not for everyone, but for a lot of people, it's very inflammatory, and it doesn't, you don't feel good after it. So, and sugar. They say that sugar is as addictive as cocaine. This causes fluctuations and everything, and it keeps you going back. And all of these things get converted into sugar anyway. So we all know we have to eat healthier. And now, question that I always get is, which diet is best for me? Because nowadays, how many different diets are there out there, right? There is paleo, there is carnivore, there is vegetarian, vegan, there is plant-based, what else? Fruitarian. There's a diet that just says all you need to do is eat fruits, grain-free, gluten-free, dairy-free. There is no one diet that fits everyone. And this is where what we do is, if you have symptoms, is we put you through the elimination diet, which is a process where we remove the most commonly inflammatory, the most common foods that cause inflammation. And then we slowly reintroduce them, because you know, unless you have celiac, it's horrible to say that you can never have gluten in your life again. So we remove all the foods. You eat a lot. It's not a diet. And then we reintroduce it one step at a time, every 3 days, and to see if any of your symptoms come back. And those symptoms could be joint pains. Symptoms could be diarrhea. It could be bloating. It could be not sleeping well, feeling depressed, you know, whatever it is. So one thing I will have you take away, and we'll probably give you a free 7-day clean eating guide at the end of day 3 for you to do on your own, is just to add more living foods into your diet every day. And a lot of people in the functional medicine space say that you should try to get 80 different colors of foods into your diet a week through vegetables. And we're not talking through M&Ms and things like that. We're talking through vegetables, 80 different types of foods through your, and it is possible, believe it or not. I've never been able to do that, but I've been experimenting with adding different things like red cabbage and this and that into my diet lately to try to get the colors of the rainbow. So that's what you could do, is just try to avoid processed foods and to increase all the greens and the vegetables and the fruits in your diet. And the reason we're talking about this as a first step is because this is all of this, and getting nutrition is what's going to increase your immune system. So if your lab work shows that, oh my God, I have a virus possibly, or I have a bacterial infection, we can help this by just starting with the basic steps, which is the foods that we're eating, which should nourish our body. Next up is the stress. We all know this. I think 100% of all of us know that we need to de-stress. I hear someone. Because stress causes us to self-sabotage. Stress causes, it's actually scientific. When they talk about prayer or meditation or just exercise and deep breathing, there's actual science about how it stimulates the vagus nerve, which is the nerve that fights against, it's not the fight or flight, but it's the rest and digest parasympathetic nervous system. Stress truly is the cause of a lot of our chronic conditions that we have. And going back to that example, when you're stressed out, if you have cold sores, that's when they surface, right? So we all know this, but we all need to do this. No one is perfect. I'm not perfect by any means. We're all a work in progress. So lifestyle changes are huge. And in today's busy world, it's just really hard, but we have to like stop and take a breath, right? So first is food, then is the stress component. Again, all tying back to the labs. You'll see improvements in your labs, but you'll see improvement in how you feel on a day-to-day basis. Now for vitamins and supplements, this goes a little deeper. While I don't like to put patients on medications or clients, in fact, my goal is always to get them off of medications. Even whether it's high blood pressure, lots of things. There are other things we can do to bring it down, but sometimes you do need vitamins and supplements because our soil isn't the same as it was. We're just not getting enough nutrition, or we have something called leaky gut where we're not absorbing. We can be eating all the vegetables we want, but our gut is inflamed, and so we're not actually getting the nutrition that we need. And so sometimes we do need supplements, but I'm not a fan of green pharmacy either, where you get 100 supplements and you know, where people come in to me, they're taking like 20, 30, 40 supplements a day. I think that we should keep it minimal, but we should definitely take the basics. Now, I want to address about absorbing your food. And there's one thing that many people are on is when they feel indigestion, they grab for a PPI like Prilosec or Tums or something like that. And while it is needed, if you have a serious condition and your doctor has told you, for the most part, I want you to think about this, and every client who comes in, we talk about it, is that if you've just eaten a meal, whether it's meat or salad or whatever, and you chewed it up and you put it in a bowl of water, versus you chewed up the meal and put it in a bowl of acid, which one is actually going to get digested, broken down so that you can get all the nutrition and then move through your body? It is going to be the one that's in the acid, because you need the acid and the digestive enzymes to really break down the food so that you can actually get the nutrition in there. So I don't know if a lot of you are on these acid suppressants or these medications. Again, only with the consent of your doctor, because there are some conditions in which you need those. I actually have successfully taken off many people off of those, and they feel better. Their bloat is gone, because now all of a sudden they're digesting their food and they're absorbing all their nutrients and the vitamins, and they feel good. So that was a side note. I just wanted to explain about acid reflux and how we're being treated for it, when it might actually be the opposite, where you need a little bit of acid to actually break down the food through supplements. I even had a client who was sleeping on 5 pillows, and she was told she can't have fruits and vegetables and all this. I actually put her on acid and digestive enzymes, and now she sleeps fine, no pillows, and she's feeling better, no bloating. She was actually lacking acid, and stress is one of the things that actually, on one hand, can increase the acid when it's too much, but it can also, as we get older, decrease the acid level in our body. So that's about the vitamins and supplements. I also wanted to share with you any vitamins and supplements that you're taking. Please do not get them from a regular store, and even the good companies, I would not get them from Amazon, because they could be sitting in someone's basement in the heat. And the stores, some of the testing has showed that there's a lot of fillers in there, and it may or may not have whatever vitamin you're looking for. And it might also be sitting on the shelf for like the longest time. Sometimes they have a 2-year shelf life. So I would recommend that you only get your vitamins and supplements from a healthcare provider, and you get pharmaceutical grade supplements. If you're interested, you can always shoot us an email. We can give you a link where you get 10% discount for thousands of supplements. And they're all pharmaceutical grade. Many are gluten-free, and it's top quality. So be very careful of where you get your supplements. Health food stores are still better than the regular stores, but definitely a healthcare practitioner. Now, I wanted to really briefly show you what we get here so that you can be motivated, that hopefully you can get this. This is our basic blood work panel that we get on everybody who walks in the door. And as you can see, there's a lot here. Today, we just discussed CBC. Tomorrow, we're going to discuss thyroid and why we need to get all of these markers, which I'm certain you don't get when you go to your doctor. They just do the TSH and maybe a T4. But tomorrow, we're going to talk about the thyroid and how it can be one of the causes of so many different things, like the canary in the coal mine. And so that's tomorrow. But we go above and beyond. And this is our basic panel. And you can take a screenshot. Maybe you can ask your doctor. But I will caution you that most of these are not covered by insurance. And this panel, probably the $20,000 panel, I'm guessing, through LabCorp or Quest. And the reason they don't cover these things is because they don't consider it the standard of care. So even for the thyroid, I've had insurance companies slap on a big bills because they said you only need a TSH. Why did you get all these things? So just make sure that it is covered by your insurance. So this gives us a snapshot, excuse me, of when a client comes in, and then we know what to do from there. This also gives us a lot of information about the nutritional status of our clients. And I'm going to show you an example blood work. For the men, we also include PSA and free PSA. We actually work with a lab that gave us a wholesale price, which we extend to any of our clients who are interested in getting this blood work done as a baseline. And we sent out a phlebotomist to your home to get this done. So if anybody's interested in that, you can always email us or put it in the chat. And Christina will get back to you. Now, I wanted to share with you guys an example of our blood work as well. Let's see. Sharing your screen. Okay. Here is the analysis that you get with it's about a 50-page. For this one is 47 pages. And so what it talks about I'm going to scroll down to give you some examples. See, we use ranges that are based on optimal physiology and not the normal population. So this is a tighter range, as I discussed before. And what we do, so here, for example, again, this is about a 50-page report. We get all those blood markers that I just discussed with you guys, or I showed you a screenshot of, and then we populate it and it tells, for example, in this client, it shows that based on all of her blood work that we got, there's a 100% chance that she has blood sugar regulation problems, meaning she could be headed to diabetes, even if it's in 5 years down the road, or even if it's sooner. We're not saying she's going to get diabetes 100%, but based on today's blood work, this is what it looks like. And we test a lot of things. It's a clickable link. So here it describes in layman's terms, see, the dysfunction is highly likely. So much improvement, you can fix this through diet and lifestyle, is needed because this client has a 100% chance that her blood sugar is not regulated. It describes it so that you can understand it. A doctor doesn't simply have the time to discuss 50 pages of all this blood work with you. It would take hours and hours and hours. And so this breaks it down for you. And over here, it actually tells you why, which markers we tested that tell us that this is likely. And these are all the markers that we tested that show us this. And again, you can go back. Same thing over here, liver function. Over here, it shows that this client has a 51% chance that dysfunction is possible and she needs improvement. Now, also gives you what can you take. These deficiencies can be caused, you might need some iron, you might need some B12 and folate, B6, copper, vitamin C. So everything is right here in the functional report. Again, over here, it talks about what markers we tested, how we come up to this conclusion. Now, this report is highly, it is very, very detailed. And we test all of that. Again, there's many ways of looking at it. I'm going to scroll down, then we talk about also allergies, the likelihood that this client is suffering from allergies. Why? We talked about the eosinophils, absolute, and then it even tells you in layman's terms why we're considering that. Same thing with the lipid panel, which we're going to discuss on day 3 in details, because a little hint, high cholesterol is not always bad. And we're going to talk about those numbers. We need cholesterol to make all of our hormones downstream, including testosterone, which is a feel-good hormone, including everything that we need. So we actually need higher levels than we think, but not too high, so there's a little dance that we have going on. So this is, I just wanted to give you guys a little preview of how we do our blood work and how even the nutrient status, it talks literally. So in this client, why is she at 75% chance that dysfunction is likely? Because of these markers that we tested. And then it also talks about, the diet and lifestyle, obviously, and we tell you what you can do to improve it. Same with the vitamin status. So this report is very, very, very comprehensive. The need for DHA, for those of you who know about hormones, the need for B12. Again, when you click on it, it gives you everything you need. So I just wanted to throw that out there too, that this is something that we offer. It's very powerful. It tells you here so for her, we did 80. Generally, this was before. Now we're testing about 100 plus markers on everyone. So it tells you one is alarmingly low. See it over here, optimal. Guess what? Blood sugar, we want it between 75 and 86. If it's above 86, we're already going to be treating it. And how are we going to be treating it? Through diet, lifestyle, food, and supplements. There are certain supplements that you can use to help bring this down. So this is another way where you can see here's optimal, above normal, below normal. And conventional is just going to say if it's over here in the orange or over here that it's not normal. We're looking for a very, very narrow range. So this then gives you the same markers and tells you how many are optimal, above optimal, high, and alarmingly high. So it gives you a very comprehensive report. And again, it's clickable where we talk about everything. So that being said, again, this one is 47. On average, it's about 50 pages. I just wanted to show you how we test. Now, I am going to open it up to see if anyone here has any questions.